Welcome to our roundtable, supported by Roche, on population health management and the role within that of self-management. The NHS is going through a great reform process at the moment, which is attempting to refocus it on delivering integrated health and social care systems, but also taking greater account of the social determinants of health. So stopping people getting sick in the first place, and people who are sick, stopping them getting sicker. And we're going to explore how that might be achieved, both in theory and in practice.
If we look back at diabetes care in 200 years' time, we will say it was ridiculously, comically ill-informed with regard to the psychology of living with a long-term condition.
We've known for more than 15 years that self-management is the default health system. Diabetes UK helped us with figures in 2003 that showed us that for people living with diabetes, they had an interaction with the healthcare system for around 5 to 10 hours a year. The rest of the time, they were out there managing their diabetes for themselves. We've also known for 13 or 14 years now that about 45% of people living with any long-term condition do not have the knowledge, skills and confidence to self-manage.
We never really empowered people with diabetes to look after and manage their own diabetes. It is a whole new game now. And so those people who are being diagnosed more recently, they're hitting the ground with much more independence and education around self-management and empowering them to take ownership of their diabetes.
We've got a good opportunity now when we're thinking about commissioning across a wider kind of sector, thinking about kind of how we encourage some of the things, some of the programs that we need to do to tackle some of the end stage of condition-specific things, to really leverage the work that we've done over the last 5 years as CCGs.
Hopefully where we would move to, as we really truly have integrated care, is looking at our budgets as a system, and actually, myself at a CCG saying to colleagues in a local authority, or our finance leads, thinking, well, actually, weight management seems to deliver some really good outcomes in the long term. Let's support you in this, and let's fund this together for the good of our population, because actually that makes sense. Forget about whose books it sits on, but actually let's do the right thing for people. And I don't think we're quite there yet.
The way people are accessing information about the healthcare, the way people are contacting their healthcare professionals is all changing, and upskilling people in social media, not necessarily social media, digital apps and things like that might be helpful in spreading information.
There's something about how you organise your services so that the main patient touching points are dealing with them as individuals, but knowing how to access those more specialist services when they're required. And that's some of the stuff that's been done on the Fylde Coast.
Whether we're actually doing population health management in practice at the moment, I don't think we are. So at the moment we are still running on quite a siloed, incentive-driven health system as a whole. But I do think we are at the cusp of starting to transition to a completely different way of working. I think the first step, one of the first steps, is in revolutionising some of the intelligence that's available across the systems.
The historical way that we've operated with industry, which has created some tension, is to be completely focused at the cost down, the unit cost down aspect, without actually really thinking about the true paradigm shift around system value and patient outcome benefit. And the dilemma that the NHS faces is, we've got financial challenges now, so that the unit cost discussion is never going to go away. But actually the bigger opportunity for longevity of service and improvements in patient outcomes is moving that dial into systems value and working with industry.